Roberta.
Okay, thank you.
All right, thank you. Let's turn to Somalia. And we have Ross Smith from WFP and Rein Paulsen from FAO. I think, Ross, you're going to go first, and then Rein. So please, you have the floor, and thank you for joining us.
Great, thanks a lot, Stefan, and appreciate the time. We'd like to share with you today the latest updates about the very worrying humanitarian situation in Somalia. I'm here in collaboration with, as you said, my colleague Rein from FAO, but we also do this work collaboratively with UNICEF, who unfortunately weren't able to join today. So yesterday, the latest IPC report for Somalia was released, and it confirms the fears that we've had that the humanitarian situation has significantly worsened, with 6.5 million people, a third of the population, facing crisis levels of hunger through March this year. This is 1.7 million more than just since January. Of these, 2 million of the most vulnerable women and children are expected to face severe hunger. So malnutrition is deepening. In 2026, we'll have over 1.8 million children under the age of 5 facing acute malnutrition, and with half of these expected to face severe malnutrition. And these are really alarming numbers for a country the size of Somalia. Somalia is in the midst of a very complex hunger crisis. 2 rainy seasons have failed, conflict and insecurity persist. Thousands of people have been forced to flee their homes in search of shelter, food, and basic services. And all of these factors have pushed the humanitarian response in Somalia, to the brink. Agencies on the ground in Somalia, including WFP, are facing a severe lack of resources. And this is really what I want to draw attention to today. Without urgent funding, the life-saving emergency food and nutrition assistance that we provide, the support from other partners, will be forced to be cut to the most vulnerable, and eventually will come to an end post-April. Due to these critical funding shortfalls, our assistance, WFP assistance, has decreased from 64 districts to 42, leaving entire areas without food assistance. And we're currently only assisting just over 600,000 of the 6.5 million people facing crisis levels of hunger. This is down from 2.2 million people facing that we supported this time last year. Life-saving nutrition services have also been slashed by more than half, from over 400,000 pregnant and breastfeeding women and children under 5 receiving support to just about 100,000 in January of this year. Cash transfers have been significantly reduced, and this is critical to mention because there are many places where access is limited and where markets are still functioning, and cash transfers are the only option for support in Somalia. When these drought conditions began late last year, we provided emergency cash transfers through the government-led systems to more than 380,000 people. This enabled them to buy food onto local markets, address urgent needs, and to anticipate the response to the drought. But we've had to completely curtail this support now. Let me finish with a couple of points here. One is that this is not the first time we've been here, and it's not the first time that people in Somalia have faced an acute hunger crisis. We saw very similar conditions in Somalia in 2022, and at that point, the international community rallied large-scale support to WFP, to FAO, to UNICEF, and to other agencies and partners, and we were able to keep famine at bay. We can do it again. We have the tools, we have all of the capacity to do so, but we are lacking the resources. Scaling up the response right now is critical to meet urgent food and nutrition needs for millions of Somalis, to prevent famine, but also to build resilience for communities to withstand these shocks and the instability in face of what is growing insecurity, but also growing extreme weather events. So I'll just finish to say we're at a precipice of another moment here, and there's a window of opportunity, but it's a very short window of opportunity that we can respond. We have the solutions, we have the tools, and there are proven solutions that exist. So let me stop there, Stefan, and I'll turn it over to Rein for some additional information from FAO.
Great, thank you. Rein, please go ahead.
Thank you, Stefan, and thanks for the opportunity, colleagues, to brief alongside my colleague Ross. Ross ran through the headline numbers, so let me just dive a bit more into impact in terms of agriculture in rural areas and a few words in terms of what to do now, building on the good comments Ross has already made. Behind the numbers that were shared with you already, we should understand that the drought is having a devastating effect on agriculture. Concretely, this means widespread crop and livestock losses in addition to large-scale displacements of people. And when reference was made to 2 rainy seasons that were missed, just to put that in number terms, when it comes to food production, the last main cereal harvest was 83% lower than the long-term average between 1995 and 2025. Livestock births have also dropped as a result. So again, all of this to say, we are facing a situation that's having a significant human impact, a devastating impact on agriculture. And the urgency of both life-saving assistance to protect lives, but also actions to prevent a collapse of rural farming, pastoral livelihoods is key. The coming months are critical. What's unfolding in Somalia now needs to be and should be understood primarily as a rural crisis, not exclusively, but primarily. By that I mean that 2/3 of the drought hotspots, 19 of the 30 hotspots identified in this IPC analysis, are in rural areas. And so behind these IPC figures that you've heard, we have pastoral communities suffering extreme hardship. Half of the 6.5 million people in crisis or worse conditions rely directly on agriculture and on livestock for their survival. And they're facing now this convergent this convergent crisis that was being described. Seed stocks threatened, ability to plant threatened, livestock, rangelands decimated by water scarcity. We have a responsibility now to act, as Ross was saying, to act immediately and to stop this crisis from worsening. And the most effective way to do that, colleagues, is to respond to people where they are. People are displacing as a result of what's happening. We know what happens when families need to flee and to move as a result of extreme hardships. We know the pressures that puts on vulnerable families. We know the tragedies that can unfold in terms of children dying and families suffering. So helping people in situ is what needs to be done. FAO's interventions, in complement to those that others are doing, are really focused then on this. Cash programs that combine both cash and locally adapted drought-resistant seeds are the types of things that need to happen straight away. Keeping animals alive through provision of water, through provision of emergency animal feed and vaccinations is all about ensuring a vital source of nutrition and to help prevent disease outbreaks and spread in animals. This, as Ross was saying, it's not about doing something new. It's about building on cutting-edge expertise that the UN family and partners has in Somalia to prevent worse outcomes. Reference was made to financing is not always about money, but we do, I think, need to be honest about just how challenging the funding situation is. For FAO's activities, we need $85 million to support 1 million of the most vulnerable, high-risk, underserved rural people at the moment. To date, we have just $6 million to respond. So we are really running on fumes. We've learned the lessons from previous droughts collectively. We understand that early and timely action saves lives. We know what's required to protect livelihoods, assets, to prevent the type of distress migration I was describing. And we also know how to address the underlying vulnerabilities from a resilience perspective. But all of this expertise can only be deployed if we have adequate resources to do so. I think it's also important that we just take a multi-season drought view to this. This is not just a particular point in time. We have successive failed rains, and we need action now that that is both mobilized quickly in response to the immediate situation, but takes a longer-term view in terms of how we're going to ensure recovery and resilience. So let me maybe end with sort of two final summary thoughts around this. First, when you look at the IPC report, as you see the details and the numbers, and as Ross was saying, a doubling of the people in IPC3 plus over the last 12-month period. Please remember, this is at its core a rural crisis whose impacts are increasingly visible across the country. And secondly, that as we act swiftly to respond to the drought as it's unfolding now, we need to get behind the government-led integrated emergency and resilience responses that are aimed at halting and reversing what's happening when it comes to food security and malnutrition. We're committed to doing that as part of the UN country teams and partners' efforts. Again, early investment is going to make a difference. We need to mobilize quickly, and I'd be happy to take questions on the analysis that's been done and the situation on the ground as relates to drought. Thank you very much, Stefan, and back to you.
Thank you very much, Rein. Thank you, Ross. Edie Lederer, Associated Press.
Thank you both very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. Ross, first, Rein has given us the figure of how much FAO needs and how much they've received. How much does WFP need and how much has it received? Secondly, you talked about rallying the same kind of international support that happened in 2022 to this famine almost crisis in Somalia now. Have you seen any indication of a rally? And to you both, what do you see as the main reasons that there's this real donor fatigue? And it's not just in Somalia, it's throughout the whole humanitarian system. Thank you.
Thank you very much. Ross, do you want to go first and then Rein?
Sure. Thanks, Stefan, and thanks, Edith. I didn't mention the WFP number, but very similar to FAO, we're looking at a shortfall, an immediate shortfall of $95 million for our programs. We will be stopping most of our activity by April without additional resources. So you will see a complete stoppage of the WFP support in Somalia shortly thereafter. So that's the critical shortfall. If things deteriorate further, if we're requiring a much larger scale response in Somalia than additional funds beyond what Rein has indicated, beyond what I've indicated, and this is the lessons that we've learned, especially from 2011, is when we respond late, it costs a lot more money, and we're not able to save as many lives. So those numbers that I've given you are just I would say the initial ones. Indeed, I mean we're not seeing that rally in response to the situation on the ground, and that's partly why Rein and I are here giving this briefing today. We need to raise the visibility on the situation in Somalia, and I really fear that despite excellent work that's been done on the ground, some of the state-of-the-art data systems and early warning, some of the state-of-the-art programs and partnerships with government and insurance systems, it's just not in the, I would say, the geopolitical interest at the moment, Somalia. And so that's unfortunate for the people of Somalia that are really suffering from the consequences of the drought at the moment. I'll stop there. Maybe Rein.
Rein, please. Yeah, go ahead.
Thank you, Stefan. Look, very quickly, I think not only have the lessons been learned from earlier droughts, but we have in place under the government's leadership, both with the Disaster Management Agency and with the ministries related to agriculture and food security, been able to coordinate really forward-looking plans. These are plans that both tackle the short-term needs and very creatively build on expertise to address the underlying vulnerabilities, to address what's happening with water scarcity issues, to address highly vulnerable rural areas. And this is, this is one of these instances where we have an extremely strongly coordinated UN effort in support of the government with civil society partners, a multi-sector layered response. And some of the frustration I think you're perhaps hearing in Ross and my voices and our collective concern is that given that we have these capabilities available, that the plans are in place, the early warning systems are in place, the triggers have been identified, the response plans are there, that really the only thing preventing life-saving response at scale is financing. This is what we're trying to address, and we're doing it through a whole series of different channels, including, by the way, not just limiting the conversation to humanitarian donors. This is also about bringing in and partnering with international financial institutions in the right way. Uh, but the situation doesn't have the attention it needs. You heard Stefan at the outset talk about Somalia being one of the contexts perhaps that isn't receiving as much attention as other situations at the moment. This analysis that's just come out from IPC and the significant deterioration in numbers over the last 12 months tells us precisely why it requires more urgent attention now. Thank you.
Thank you very much. Pam and then Gabriel.
Thank you to both Mr. Smith and Mr. Paulsen. It's Pamela Falk from U.S. News and World Report. First, the IPC data shows almost 2 million children, and I think you mentioned it, under the age of 5 facing acute malnutrition and getting worse. I know UNICEF is not here today, but are they able to do any of the food in the box or deliveries to any of those? And then on a totally separate front, both of you mentioned the movement of people and fleeing. I saw some report that said that most of, a large part of that was IDPs, that they're fleeing within Somalia. Can you confirm that? And if they are leaving the country, where are they going? And is all of that complicating any kind of humanitarian aid efforts? Thank you.
Thank you. Go ahead, either Rein or Ross.
Sure, maybe I'll comment on the first question, and maybe Rein, if you want to touch on some of the displacement, and you talked about the rural dimensions to this. Indeed, I mean, we work closely with UNICEF, Pamela, and the malnutrition situation, the 1.8 million children, almost 500,000 that are facing severe malnutrition are, as I said, really shocking numbers. And so, indeed, UNICEF is we work closely with them on nutrition treatment, nutrition prevention, but they're in a similar situation to all of us as a community in terms of funding that response. So the tools are there, in terms of both nutrition treatment, to the product-based approach, the working with, where there are through the Ministry of Health and the government health centers, but also those run by NGOs and others, and extending that reach into some of the most difficult areas. So we do have that capacity.
Thank you.
Rein, over to you.
Thank you, Gabriel.
Oh, no.
Oh, sorry. I'm sorry, Rein. Sorry, I apologize. Go ahead.
No, not at all. Just quickly on the question around displacement. So the analysis is describing displacement at a level of about 212,000 people estimated by the end of March. And you're right, that is internally displaced people. And as I think I may have mentioned before, if I didn't, forgive me, that a majority of those are displaced directly as a result of a drought, and about 36% of them more as a result of conflict. But really, we're seeing people move as a result of livestock dying, as a result of crops failing, and that's why we need to respond in situ. I don't have, and we're not the best placed agency to comment on any cross-border movements. I'd defer to HER separately around that. But that figure of 212,000 does relate specifically to internally displaced people as described in the analysis. Yeah.
Thank you.
Thank you. Gabriel?
Thank you, gentlemen, for the important briefing. This is Gabriel Elizondo from Al Jazeera English. Ross, you mentioned a couple times in your remarks and in the Q&A about having to stop all services in Somalia after April. Can you give a little more detail about what exactly that would look like and what that means to the situation on the ground, some granularity in terms of what it means to stop your services there? And then you also mentioned that the WFP is only providing, is providing food to 600,000 of the 6.5 million people in critical stages of hunger. That's 10%. So if you stop at the end of April, basically, is it correct to say that the 10% that you're able to provide to might no longer get food?
Go ahead, Ross.
Yeah. I mean, I think that's the correct interpretation. So, so that stoppage that I referred to in April is related to this emergency assistance program. So the 600,000 people per month that are receiving this targeted emergency assistance, and that the resources, the pipeline that we have for that doesn't go beyond April. Very small component, perhaps 40,000 would extend for 1 to 2 months additional. And then we also, very concerned about the nutrition activities as well. And so those activities, which is additional in collaboration with UNICEF, nutrition treatment programs that we run, also would face shortfalls from April.
Thank you. Namo? Oh, okay, great. Anyone else? Thank you all, Ross and Rein. Thank you very much for taking the time, and do come back whenever you want. You've got a platform here available to you whenever you want.
Thank you so
Thank
much,
you.
Stefan and colleagues.
Thanks very much.
Thanks.